Here, though, today Erie County legislators got to question the county's health director for the first time in 2 months regarding COVID-19. The meeting was held virtually. Channel 2's Dave McKinley has more about what lawmakers wanted to know, Dave, and also how she answered.
It is the first time we've seen Dr. Burstein in a while as well, Kate, as the county hasn't held any weekly COVID briefings with reporters as of late. Via Zoom, Burstein cheerfully reported that COVID cases in Erie County are at their lowest rate since last August, that numbers continue to drop rapidly after a seasonal surge, and that 75% of the county's populace has been fully vaccinated, including 2/3 of teenagers. Meanwhile, we are now approaching meeting the metrics laid out by the county executive for lifting a remaining mask mandate for county-owned buildings.
If we're already, so low right now, when do you think that we might get there?
Again, I don't have a crystal ball, but if we, stay on track with our current trends, hopefully in another couple weeks.
Burstein was also asked, among other things, why the county continues to have a state of emergency, which, as long as it exists, she will continue to receive overtime on top of her more than $200,000 a year salary. Despite being the chief public health officer, she says the decision to lift it rests with the county executive, who also hasn't held a COVID briefing with reporters in more than a month. County Executive Poloncarz says he regularly consults his COVID-19 management team. Today, Burstein confirmed that she's the only one on that panel with a medical degree. And she is, of course, a pediatrician. Speaking of kids, though, they're still subject to masking in schools. More about that coming up at 5. Kate?
All right, we'll see you then, Dave. Thank you.